Hi, and welcome to Alleviate Dry Eye. I'm Dr. Pam Terrio, the author of the book Alleviate Dry Eye, and also a dry eye specialist here in Shreveport, Louisiana. Today, I am honored to have a special guest with me, Dr. Pavly Moawad. She is a lecturer and consultant ophthalmologist at Cairo University Hospital. So she's come a long way to join us. And we're so glad to have her because she has a significant specialty in Sjogren syndrome patients. So that's what we're going to be exploring today. Thanks for joining me today, Dr. Moawad.
It's my pleasure and my honor to have you, Dr. Pam, today and all of your very dear patients.
Well, thank you. I'm so glad we were able to find a time zone that would work for both of us. And
yes,
I can't wait to jump in and talk about all about Sjogren syndrome. So can you tell us what Sjogren syndrome is?
Okay. Sjogren syndrome is an autoimmune disorder. Okay, it's an autoimmune disease. So we can simply say in brief words that it is dysfunction in the immune system of the body. But the main characteristics is that it causes dryness in the eyes, in the mouth, skin, vagina. All these organs experience dryness in Sjogren syndrome because this disease attacks the glands that secretes secretions that lubricate our body, different parts of our body. But the main two organs are dry eye and dry mouth. These are the two main organs that are affected in Sjogren syndrome.
Right. And so patients are often putting lots of lubricating drops into their eyes and then having to put stuff in their mouth as well. Is that what you find? They have to lubricate their eyes and their mouth constantly?
Okay. If the patient experiences severe dry eye, which is defined by more than 3 times, he's in need to put lubricating eye drops more than 3 times per day, and he has experiencing these symptoms more than 3 months, in addition to the dry mouth. So this is like we have like a red flag. He has to consult an ophthalmologist and he has to consult immunologist or a rheumatologist. It's a very important point that Sjogren syndrome is a multidisciplinary approach. It requires, it's like a puzzle, you know, it's like a puzzle which is played by the ophthalmologist, by the dentist or the oral medicine in specific, and the immunologist. In addition, if a patient is a female and she has like a dry vagina or something, also the gynecologist will work with us. If the patient has dry skin, the dermatologist will work with us like this. But the main puzzle is played by the ophthalmologist, the dentist, oral medicine, and finally by the rheumatologist. If the patient is diagnosed as Sjogren syndrome, the condition is not only about lubrication. It's about lubrication for his symptomatic relief, but he will need another systemic immunosuppression. And this is a very important part of the story, because if we didn't control the autoimmune disease, we will be in activity and we will be in progression, and the patient can enter into many complications which can be preventable.
So the earlier they're diagnosed, the better?
Of course, the better is to consult and to have medical advice of the rheumatologist if any of these warning signs are present, in order to start treatment early, because if we start treatment early, it will prevent more and more of complications. So of course, the questions that will come to all of us, our minds: I'm using eye drops more than 3 times per day. It's 3 times per day. All of us have dry eye. Many patients have dry eye 3 times per day. Lubricant is not a big issue. So all these patients have Sjogren syndrome? The answer, of course, is not.
No.
Let's simplify that we have certain criteria for the diagnosis of Sjogren syndrome. It's not like just like dry eye, dry mouth, not simple as this. As we told that it was a puzzle, so we have a certain criteria in the eye and certain criteria in the mouth, in addition to lab test, which is anti-Ru and anti-La. Certain lab tests will be ordered by the immunologist, and a biopsy of the salivary glands will be taken and analyzed, and consequently we can reach if we are Sjogren syndrome or not. Okay, so if you are experiencing severe symptoms of dry eye, and if these symptoms of dry eye are accompanied by dryness in your mouth or in any part of your skin or vagina, as we said, so this is a red flag and you have to consult your immunologist. Okay. The second point is Sjogren syndrome has two major types, the primary one and the secondary one. Okay. The secondary one is if you already have an autoimmune disease like rheumatoid arthritis, systemic lupus erythematosus, systemic sclerosis, many list of another autoimmune disease, you may have Sjogren syndrome on top of these diseases. Okay, so this is named secondary Sjogren. So if you are a patient with rheumatoid arthritis or systemic lupus or any of these diseases, and you have dryness in your eyes or in your mouth, no, you have to consult your immunologist, and you have to tell him about your concern of Sjogren syndrome in order to reach the proper diagnosis and the proper approach. The first type, which is the primary type, is not common as that of the secondary one, and the patient usually doesn't have any systemic disease or any autoimmune disease, but he just experiences these symptoms of dryness, maybe symptoms of dryness only, or maybe accompanied by other manifestations like joint pains, cardiovascular manifestation, GIT. It attacks many organs in the body. So the key is to pick up these cases at early stages in order to reach our diagnosis and proper treatment. The point also that I want to enhance is many of these patients of Sjogren syndrome are at a higher risk than the normal population for lymphomas. So if the patient is diagnosed as Sjogren syndrome, he has three major cornerstones in management. The major number one is a symptomatic relief for her symptoms of dryness. Number two is a systemic immunosuppression, and number three is frequent following up and monitoring these patients, because they are at higher risk, a slightly higher risk for lymphomas. So the diagnosis of Sjogren syndrome is very important for having a better prognosis if it is present. But I don't want my words to make patients more afraid or panic, because it's not that big incidence. But dry eye may be the iceberg of Sjogren syndrome. Unfortunately, I have met many patients that the condition started with just a dry eye, and after many years, it has been shown that it was Sjogren syndrome, and they should start immunosuppression early in order to prevent such systemic complications.
Right. So the earlier we catch the patients as actually being Sjogren syndrome, then the earlier they can be on systemic medications that'll slow the disease down, perhaps.
Yeah. Yes, yeah. Exactly.
That's wonderful. So there are treatments, and on top of doing the dry eye therapy, there are things that they can do, which is wonderful. Does it tend to be hereditary? Does it run in families, Sjogren's disease?
It's not hereditary, but there is a genetic predisposition. Some patients are genetically predisposed more than others to Sjogren syndrome. In addition, we have multiple infections. It can be a trigger to Sjogren syndrome. And this includes hepatitis C, HIV, Epstein parvovirus. All these infections have been accused of being a trigger of Sjogren syndrome, but the exact etiology or pathogenesis is not clearly understood. But it is not contagious, and it is not hereditary.
Wow, that's interesting. I didn't realize it was quite so complicated. So when you see a Sjogren's patient in your clinic and you already have that diagnosis, is there a particular treatment that you like to always put them on? As far as, do you always start them on ocular immunosuppressants, ocular eye drops that that suppress the inflammation in their eyes, or how do you go about that?
Yes. Okay. When a patient is newly coming and I suspected that he has Sjogren syndrome, first, when I suspect that the patient has Sjogren syndrome, if I do a simple test, a Schirmer test, and I find that, as we said previously, that this disease attacks the glands, attacks the secretions of the glands. So it makes the AKIS component is much lower. Schirmer test is less than 5 millimeter, which is very low reading. If the patient has Schirmer below 5, or he has positive staining in his cornea and conjunctiva by vital dyes, I refer to the immunologist and I began my journey with the patient accordingly. If he has an evidence of staining on the cornea, I start with extensive preservative-free lubricants, in addition to topical immunomodulators, like I tried cyclosporin eye drops and tacrolimus. Both of them are very effective, actually, and they are mandatory in these patients because they have ongoing inflammatory process on their ocular surface. The condition will not be relieved by just lubricant eye drops.
Right. You need to give them an anti-inflammatory.
Optimizing the ocular surface by immunosuppressives, by preservative-free shelters, especially those that contain trehalose. Dr. Pam, you are with me?
Yeah, I'm here. You froze for a minute, so I wonder if I froze on your side. Yeah, it's probably just an internet issue. You're still coming through, though. Maybe not.
Hello?
Oh, I hear you. Your face is just frozen. Oh, no, yeah, now you're back. Okay.
Oh, okay. Okay. After optimizing the ocular surface with preservative-free artificial tears, especially those containing trehalose. Trehalose is very effective in regenerating the corneal epithelium, really. And topical immunomodulators like cyclosporin or tacrolimus. I didn't have experience with Zedra, lefitigrast. I didn't have experience, actually, but I hope to try it, but I didn't, because it's quite expensive in our countries.
Right.
Yes. After optimizing the surface with this, and sometimes also I use autologous serum eye drops. Sometimes I use amniotic membrane, fresh amniotic membrane, if the patient has severe dryness or persistent epithelial defect. I use these every tool in order to optimize the surface.
We have, right?
Yeah. At last, I think of punctum blocks. After optimizing the surface and after I'm sure that the surface is okay, but it takes a lot of months, by the way, in order to reach a good condition of the ocular surface, because as you know, punctum plugs raise the reserve of the tear film, but it also decreases the turnover of the tear film. So if the tear film has inflammatory mediators, it will worsen the condition. It will not, the patient will not benefit. Right. And also, of course, the condition cannot be managed except after management of the meibomian glands, because like more than 90% of the patients have meibomian gland dysfunction, even in these Sjogren syndrome patients. Correct. Although there are no papers or no publications, strong evidence about the attacking of Sjogren syndrome, or yes, a correlation of Sjogren syndrome and meibomian gland dysfunction, but that the patients of Sjogren syndrome, most of them have also meibomian gland dysfunction. So after treatment of meibomian gland dysfunction and after optimizing the inflammation on the surface, may I consider punctum plugs at last. But there are, like I said, many tools autologous serum eye drops, like the amniotic membrane. Also, we are not lucky to have the biologic eye drops like Regener eyes, but also I wish I can try it, but also it's not available. The idea is to optimize the surface by addressing the inflammation on the ocular surface, and by helping the corneal epithelium to regenerate, and to provide lubrication as much as you can by preservative free. And it's good if you can use like some ingredients like trehalose, like vitamin A, something that can also do additional work in addition to the ordinary components of the artificial tears, like hyaluronic acid, CMC, and so on. As I told you, these are my my plan for seeing a patient who is suffering from dry eye. And of course, the educational and the counseling of the patient plays like 90% of the story, because I have to make the patient, I always tell him that it is a matter of 3C. We have a problem with a chronicity. It is a chronic condition, and it is a cure. It's not totally curable condition, so you have to understand this condition. And it requires compliance. It requires a very strict compliance from your side. So I always make the patient, try to make the patient understand that we are facing this matter of 3 C's. In order to make expectations of the patient much more logic, and to accept that we are ongoing journey. We have to cooperate with each from his side. He has not to be frustrated if he is like 1 month and he is expecting he will be off medications. Yeah, he will be off medications. He will no. And in addition, also to a routine lifestyle like drinking water, hydrating our bodies, as you always tell, hydrating our bodies and hydrating our eyes.
Right.
as you always tell, eating healthy food rich in omega-3. Instructions that are related to computer vision syndrome, of course, because we are all facing CVS, even our kids. All these have to work hand in hand in order to provide symptomatic relief for the patient, and to alleviate his suffering, and helping him really. And this is hand in hand with the doctor, the immunologist or the rheumatologist, who have the great part of the story of prescribing systemic treatment, and following if the patient is indicated for so, and following up if the patient has any complications related to this systemic immunosuppressives or something.
Wonderful. That is a ton of awesome information for everyone. I really appreciate your time. Let's see, if you think that you use eye drops more than 3 times a day, and you also have dry mouth in addition to your dry eye, then you should see your eye care practitioner right away and let them know that this is what's going on. And then they can make the referral to rheumatology and do the blood work to find out if you have Sjogren's syndrome. So I think that is a wonderful tip to end on, so that everyone knows kind of some guidelines. And thank you again, Dr. Moawad, for being here with us today. I truly appreciate you being here. And if we learn how to take care of our eyes today, our vision can last us a lifetime. Thanks for joining me.
Dr. Pam, it's my pleasure and my honor to be with a wonderful person like you. Really, it's my pleasure and my honor, and I hope that I can added any new information or new benefit to your great audience. Of course, all of us, our target is to help patients to have better lifestyle and to have better eyes.
Yes, thank you.